All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So I had a lot of topics to catch up on, so I thought I'll do some discussions early on as well. Plus, this time I did not draw a lot, rather I want to go over some of the studies. So let's see if you like this format or not. This enables me to scale to more talks. Let's start. So this is drbeen.com. If you would like to support this work, there is a link in the description and you can get access to drbeen.com, or just $5 a month you can become part of our patrons as well. This is a study. Now, I would request your attention with this study because the study is actually from CDC. It is funded by CDC. It is conducted by CDC team. Still, I feel that there is a level of concern in here which they kind of not allude to, but I would like us to look at it. So have that in your mind. In addition to this study, I have a couple of more studies as well. This is a study I had discussed in the past. This is from the Seattle Children's Hospital, where the excuse me, where the effects of myocarditis, imaging effects, were present even after 5 months in almost all the patients. Children, patients being children. Then here is another study. This is from Boston Children's Hospital. And there as well, if you see persistent LGE, that is the gadolinium imaging enhancement. LGE was subepicardial in 5 patients, mid-wall in 3, subendocardial in 1. So they explain that even at the follow-up, patients had, even when they felt that they had recovered and they had asked them to continue with their normal general life activities, even then there were presence of the imaging abnormalities at various parts of the heart. So this is that study, links in the description. And here is the study that I would like us to look at it. So first, let's start from their conclusion. Then we look at the data. Their interpretation is the following. After at least 90 days, and I have marked it here in green, after at least 90 days, since onset of myocarditis after mRNA COVID-19 vaccination, most individuals in our cohort were considered recovered by healthcare providers. And I'll explain what these words actually allude to. And quality of life measures were comparable to those in pre-pandemic and early pandemic population of a similar age. Age is 12 years to 29 years. Now, the most important thing here is the word most individuals. This most over here is the statistical term and not English language general word. What they are meaning is that the patients who had developed myocarditis after vaccination, children, 90 days after, more than half, if they are more than half, they will be most. They'll be called most. So it is actually exactly to be accurate, 68%. So they said most patients had recovered. And that is their interpretation, that, hey, all good for most patients. 32%, I believe. So let's go back and look at the data. So some abnormalities were so there are various percentages for various abnormalities. So let's look at them. Let's start from the biggest outcome. 90 days after the follow-up, 90 days after developing the myocarditis with the vaccination, during the follow-up, how many of the patients were cleared for physical activity? I would consider that to be an important event. So here, check this out. At follow-up, most patients, once again, this most is a statistical most, not English most patients were cleared for all physical activity, 68% of 393 patients. So 32% were not cleared after 90 days of developing um, myocarditis after vaccination. So there are a couple of things here which we should acknowledge. Number one, they do not present out of how many are these 393, meaning were they there 1 million doses or 2 million doses? So what was the cohort? So because of that, you cannot actually interpret the percentage of occurrence of the event, or incidence is not calculatable here. The second thing to keep in mind, and I think some of us will be thinking, I was thinking about it when I was reading this, and that was, what is a comorbidity? Maybe majority of the patient, or let's say most patients, in the same statistical way, most patients who got the vaccine were, I shouldn't say patients, most individuals who got the vaccine had comorbidities. Maybe that is why. But in this cohort that we're talking about half, or I think 54% had comorbidities. The remaining were healthy. So this has been a curiosity in my head for a long time, that what percentage of healthy versus patients with comorbidities, they develop these issues. Because a child that has um, a comorbidity that may be life threatening, or if COVID occurs on top of that, could be life threatening, then thinking about vaccine is very important. So about half of the patients had comorbidities. And I'll show you that data. So this is very interesting. That means about half of healthy individuals, healthy children. I don't want to say 29 years are children. So 12 to that, mean age was, I believe, mean age was 17 years. So you can call them children. Majority children developing myocarditis 90 days later, still majority children, meaning majority of the people, children in this group, and then they had the myocarditis. So let's look at this. An abnormality was noted among 81, 54% of 151 patients with follow-up cardiac MRI. So first, why are there various numbers? We just saw 393, now we are seeing 151. So what happened was, there were about 1,800 some individuals that they thought can participate in this study. This is actually a observational study or surveillance study. So it's not that they asked them to, they just looked at their data. And then once they found that there are patients who had myocarditis, then they reached out to them and said, we want to do follow-up with you. That follow-up was done by either the patient self-reporting about their symptoms, or a healthcare provider reporting about their symptoms, or a combination of self-report plus healthcare provider report. And it is interesting that healthcare providers, actually, in majority of the cases, healthcare providers had said that the patient is okay, while the abnormalities were still persistent. So with this now, 151 followed up for MRI. Children, 151, 90 days after, followed up for MRI. Half, 54%. 54%. So I can use a statistical term here, most. Most of these, but to be more accurate, 54%, still had MRI abnormalities after 90 days. This is kind of in a similar line as we saw here with the Seattle Children's Hospital. This was a small study, I believe, of 12 patients. This is also a small study, but and even this CDC study is small as well, 393 patients. But all of those studies show children who develop myocarditis continuing to have issues. Now, what kind of issues they were seeing? So, check this out. Most patients had improvements in cardiac diagnostic marker and testing data at follow up, including normal or back to baseline troponin concentration, 91% of 200 patients. So, 200 patients offered themselves for the troponin testing, out of which 91% had recovered 90 days after. That also means 9% had not. Echo, 94% of 279. So 6% echo was not, they were not, echoes were not normal in 6% after 90 days. EKG, 77% EKG became okay, and then 23% no, not okay. Exercise stress testing, 90% of 194 had recovered for exercise stress testing. And that also means 10% of the children or these youngsters who got myocarditis after the vaccination, 10% after 90 days still had exercise tolerance test failure. Ambulatory rhythm monitoring. So they put the Holter monitor or some other monitoring device and look at the rhythm. 90% had gotten their rhythm back to normal. That means 10% after 90 days didn't have their rhythm back to normal. So check this one out. Median patient age, I think I said mean before, median patient age was 17 years. Range was from 15 to, interquartile range was 15 to 22. 457, 88% patients were male, and 61, 12% were female. You would actually see, I'm going to show you the data now. You would see that majority are males, and in them, the ones who did not recover, majority in them, in these males, were white and between 15 to 19 years of age. That was the main group that did not recover very well. Second group that was impacted was Hispanic. Okay, so median age 17, 488% males, 12% females. 81% of 393 patients with a healthcare provider assessment were considered recovered. So when healthcare provider looked at them in 90 days, 81% of them were told that, hey, you're fine. Although at the last healthcare provider follow-up, 26% of 393 patients were prescribed daily medication related to myocarditis. These children were getting medicines for myocarditis, 26% of them, even after 90 days. Of 249 individuals who completed the quality of life portion, so there was a quality of life question as well. 2% reported problems with self-care, 13 or 5% with mobility, 20% with performing usual activities, 30% with pain, 46% with depression. Okay, so now I'm going to go into the last part of this talk and show you a table. But before we go there, please make up your mind that how do you interpret this? Again, I'm not looking for someone who doesn't like the vaccine to attack the someone who likes a vaccine or the other way around, but more of a healthy discussion and debate, and or not even debate, an input for how do you see it. I felt I usually look at the studies by first going to their interpretations or results to see what is it that they're talking about and looking at their objectives. Then I look at the data. So when I looked at it here, remember I actually marked it green because I thought, oh, they're saying that almost everyone, most individuals were considered recovered. So then I went to the data. Let's look at the data. This is their table, really interesting table. Okay, so the very first column is various properties of the cohort. Second column are the children or the youngsters that had recovered. Third column is those that by 90 days had not recovered. So let's look at it. Age 12 to 14 years group. Out of 320 that had recovered, 18% of them were in 12 to 14. So which group recovered the most? 15 to 19. At the same time, which group also had the most, out of those who did not recover, the most proportion was also for 15 to 19, and males. We'll see that down here in a second. So those who did not recover, they were 65. 9 in 12 to 14 years of age. 15 to 19 years of age, 35 or 54% of the total not recovering children were 15 to 19 years of age. 20 to 24, 23% of not recovering group. 25 to 29, 9%. Now, males recovered and not recovered, but they had, remember, all of these are the folks who developed myocarditis after the vaccine. So they all developed it. So if you see majority, 88% were males, 12% females. Now in those, the group that recovered, 91% of males. Out of all of those who were recovered, 91% were males, 9% were females. Out of those that did not recover at 90 days, 86% were males and 14% were females. So some females also did not recover, more than those that recovered. Race and ethnicity: white, non-Hispanic, 57% who recovered, and 49% out of all of those who did not recover. So almost half of non-recovering children were white. And if you see here, the second larger group is Hispanic. Then comorbidities. And of course, vaccination, ideally they all were vaccinated, and that is how they started becoming part of the surveillance. So if you then go down here, underlying medical conditions or comorbidities, at least one condition excluding obesity in those who did not recover, 62. Out of them, 25% had at least one morbidity excluding obesity. And at the bottom, if you look at the obesity, that was an additional 25%. So really, in those children or youngsters who did not recover 90 days after their first myocarditis incidents after the vaccine, 50% of them had comorbidities, 25% asthma, autoimmune diseases, and other, and 25% obesity or were obese. So this was interesting for me. I had been looking for this data for some time to understand. We had one study from UK on, I believe, 62 children. After that, we didn't have a very decent breakdown. So here is an interesting one. So all those children who developed myocarditis after the vaccine, and then 90 days after, those out of this whole group that did not recover, in this non-recovering group, about half, 49, about half, or actually half, 50%, had comorbidities. And within that half that had comorbidities, one half of that half, or one quarter, were obese, and the others had comorbidities, for example, asthma, autoimmune diseases, arrhythmia, congenital heart disease, genetic or chromosomal abnormalities, previous heart failures, Kawasaki disease, myocarditis, type 1 diabetes. In here, if you see, the larger proportion was asthma. And this continues to the next page. Here, the kind of symptoms that patients had, the children had. So, what do the children say after developing, or when they develop myocarditis the first time after the vaccination? At least they develop one symptom, and the most common symptom for those who did not recover was starting with chest pain or discomfort. Actually, it is also most common for those who recovered. Then I believe the second most common was 43% fatigue. Third most common was chest pain or discomfort while resting. Discomfort at rest. That is, I had, of course, other than children that have comorbidities, I had not heard of this kind of a situation for children. Discomfort at rest is the unstable angina that we hear about as we grow older. It can happen to us. But anyways, here there were 39% of non-recovering that complaint of that. 23% of those who recovered complained of chest pain or discomfort while resting. So this is the data. Just a quick review. This data, Seattle Children's Hospital, I have done a complete discussion about this one in the past. Just very quickly, repeat cardiac MRI. So they had followed up children up to 5 months, and I think some of them even 8 months. And then this particular researchers group had said that they will follow up a year later. So I'm sure they have an update somewhere, or they're readying an update. Repeat cardiac MRI was performed within 3 to 6 months to guide next clinical decision-making steps. Timing was modified in some individuals based on scanner accessibility and safety precaution, etc. So remember, this is a different study now. This is a Seattle Children's Hospital. Although symptoms were transient and most patients appear to respond to treatment, we demonstrated persistence of abnormal findings on cardiac MRI at follow-up in most patients, albeit with improvement in extent of LGE. This study is smaller than CDC study. CDC study says most patients recovered. This study says most patient had imaging abnormality. However, if you go back to the CDC study as well, and if you look at the imaging part of it, or MRI, magnetic resonance imaging, an abnormality was noted among 54%. So you could use the same most here as well. Most patients after 3 months, even in the CDC study, had imaging abnormality. That is the same case here with the Seattle hospital too. And here is the Boston Children's Hospital. All patients had normal ventricular systolic function on follow-up CMR. LGE, LGE, gadolinium imaging, was persistent in 8 patients, 80% of the patients, although improved from prior in all cases. Persistent LGE, this is Boston, this is the third study. Persistent LGE was subepicardial, so epicardium, and below that, subepicardial in 5 patients, mid wall, so the central wall of the heart, in 3, subendocardial. So endocardium is the inner uh, surface of the heart, and just below the inner surface, just below the skin on the inner side. It's not really the skin, it is endocardium, in 1, and localized to the basal infralateral region, so lower and slightly on the side, in 6 patients. Basal inferior region, lower and at the base, in 1 patient, and basal left ventricular free wall in 1 patient. So this is 80% in Boston Children's Hospital, small study. Seattle, most. I think they had almost all 11 or 12 showing these signs, even after 5 to 6 months. And imaging abnormalities, even for the CDC one, are 54% of the ones that came back. Still, their interpretation became, after at least 90 days since onset of myocarditis, after mRNA COVID-19 vaccination, most individuals in our cohort were considered recovered by healthcare providers, and quality of life measures were comparable to those before. Cool. So this is one discussion. This study that I just showed you, links are in the description. This was on 21st September. It was published. I am a little disappointed, and my disappointment is, little is just a rhetorical word. My disappointment is they could have taken better decisions based on this. For example, they could have come back and said, you know what, children with comorbidities, and then specifically following comorbidities, may need vaccine more than healthy children, and so on. So they can make a lot of good decisions. Anyways, that data is presented, and I think we are supposed to digest it and figure it out. Okay, so this is the discussion. I might appear a couple of more times to do some more discussions as well. Please like, subscribe, and share. We're almost at 600,000, almost 2,000 subscribers left. So help me reach there. So like, subscribe, and share. And if you would like to support this work, my work actually is supported by you now. For 2.5 years, as I worked more for COVID, most of my work just became dependent upon your support. So there are links in the description if you would like to support this work. With this, thank you very much. Talk to you later.